Hi there, Dr. Erica Wood, and we're going to talk about thyroid gland and so much more. Okay, so this is part 2. So we're looking at our thyroid. It's my favorite thing to talk about with patients. So we have thyroid. It's a butterfly-shaped gland that hangs out by your neck. It's made of 2 lobes, a right and a left, and has an isthmus that connects the center. We have follicles, which are cells that make what's called thyroid globulin, which are precursors to thyroid hormone. Then we have colloid that is in the center, that when we take a cross section of histology, we see this pink, beautiful material that is thyroid globulin plus iodine, and that's the precursor to our thyroid hormone. Then we have parafollicular cells, which make calcitonin. Calcitonin responds to too high of calcium. So looking at the anatomy here, this is our thyroid gland right here, highly vascularized. Cross section on histology, we see all this colloid here. We have our follicular cells around here and our parafollicular cells right here. Thyroid hormone comes in 2 flavors. We have T4 and T3. So T4 means that it has 4 iodine molecules bound to it, and then we have T3, which means there's 3 iodine molecules bound to it. In order for T3 to be worked, in order for T3 to be, I guess, stored, it needs to be stored at as T4, and this gets converted at tissue level. Okay, so as said, thyroid hormone affects basically everything in the body. Enters the target cells via intranuclear receptors. Intranuclear receptors, because with the exception of all the other peptide hormones, it's the only one that can get through. Thyroid hormone means it increases our basal metabolic rate and heat production, known as a cholinergic effect. It also regulates tissue growth and development. It's really important, especially in children, to make sure thyroid is functioning properly. Otherwise, we can't get normal skeletal and nervous system or reproductive capabilities occurring. And then helps maintain blood pressure by helping almost synergistically working with others. So T3, or free T3, is our active form of thyroid hormone. It's the one that does the most ability, the one that we get the most bang for our buck. Then we have T4, which is the inactive form, which gets stored and bound in tissues until we need to activate it. We need important nutrients for thyroid hormone to understand is that we need iodine to have the thyroid hormone made, because that's what it's made of. We also need selenium, because it's really important for thyroid production. Thyroid hormone in the body can be free, which is the ones that really do the most of its effect, or we have bound to thyroid globulin. A lot of times when we're looking at autoimmune conditions of the thyroid, we take a look at how much of that thyroid globulin is being raised. So we don't have to really go into the nitty gritty of how the thyroid hormone is made, just understand that iodine is really important. Oops. And then thyroid hormone reacts to negative feedback, just like the rest of the thyroid hormones. And here's a representation there. So when hyposecretion of thyroid hormone occurs, this is known as hypothyroidism. This can be called myasthenia, which is low metabolic rate. So people are going to be gaining weight, not feeling good. They're going to have thick or dry skin, get puffy eyes, feel always cold, can't poop, get swelling, feel like their brain is farting all the time, and as I said, get really tired. If there's lack of iodine in the diet, you might get goiter. This does not typically happen in this country. Goiter means enlargement of the thyroid gland. So when there's something, when a child is born with congenital hypothyroidism, can be very crucial, and they'll need lifelong support to keep that thyroid hormones they can keep developing in a safe manner. So this picture right here, as I said, it doesn't really happen in our country, but it happens in other countries. This right here is not normal. That is goiter. That's enlargement of the thyroid gland. With the opposite end of the spectrum, which I discussed briefly in the last lecture, which is known as Graves' disease. Basically, Graves' disease is responsible for, Graves' disease means that we're doing everything in opposite. So we get elevated metabolic rate, sweating, rapid irregular heartbeats. People might feel really anxious and lots of weight loss despite they're constantly hungry. And for both, medications are available, either hypo or hyper, but typically in hyper, they'll normally just take out thyroid to solve the problem per se. And this is an example of in Graves' disease. Sometimes you might see people's eyes bugging out of their head. This is called oxophthalmos. It's because the thyroid hormone has an affinity for glands that, glands that are responsible in the eye sockets, and these push things out. I said calcitonin, and it's really response to high calcium levels. These are being made by the thyroid. Parathyroid gland, I feel like we kind of went to this a whole lot. I don't really need to touch base on it, but no, it's a response to low calcium and it in the blood, and its job is for calcium homeostasis as well. We already know that it works on the osteoclast to trigger bone matrix to be broken down so more calcium can be relayed to the blood. We know it can enhance the reabsorption of calcium into the digestive or secrete and also secrete phosphate by the kidneys. And then we need vitamin D because vitamin D is activated by, promotes activation of vitamin D, which we need parathyroid hormone for vitamin D to work. And that way we can bring in calcium by our GI tract. Here is a little representation of how that all works. Yes, you might be questioned on this, so take a good look at it. Hyperparathyroidism is normally, as I said, due to a parathyroid gland tumor. Basically, there's just, we see elevated calcium levels because the parathyroid glands are hyperactive. A lot of times what we'll see is kidney stones. It's called moans, bones, and groans. So moans is from the kidney stones. Bones is because the bones are leaching out calcium, so there's freaking breaks and you get stomach aches, the groans. Hypoparathyroidism is not normally that common. It's normally honestly happening when they take a thyroid gland out and they accidentally take out all the parathyroid glands by accident and they get hypocalcemia. So adrenal glands, there's these two little yellow shaped glands that sit on top of the kidney. They're suprarenal, but I just call them adrenal. We have two parts of the adrenal gland with the adrenal medulla, which is the inside, which is our sympathetic nervous system. So that makes epinephrine and norepinephrine. Then we have adrenal cortex. And these, depending on the layer that you are at the tissues, they secrete different kinds of hormones. So it's going to sound weird, but the way to remember this is the deeper you go, the better it gets. Sorry for the, yeah, that. And the reason why is that the zona glomerulosa is the most superficial aspect of the adrenal cortex, and it makes mineralocorticoids, which are responsible for salt regulation. We have the zona fasciculata, which is responsible for sugar regulation with the glucocorticoids, and sex is the most inner, deepest layer of the cortex, and that is responsible for making the androgens, so testosterone. And as you can see, if we look at the microscope histologically, we are seeing that we are, each layer has a distinct look because they're all doing different things. So medulla looks very different from where you see the, zona reticularis right here, zona fasciculata, and the zona glomerulosa. So the major hormones that are coming from each zona glomerulosa is making aldosterone. Zona fasciculata is cortisol, is the one I'm mainly concerned with, and DHEA. And zona reticularis is doing the androgens. So mineralocorticoids, their job is to regulate electrolyte concentrations, mainly sodium. And the most important one that we have that comes out are aldosterone. So when aldosterone is secreted, it causes the kidneys to reabsorb sodium, which can help bring up blood volume and blood pressure. So we remember the renin-angiotensin system. This is a key hormone in that system as well. And it can stimulate potassium release from the kidneys, which in turn helps bring up blood volume as well. Well, helps turn down blood volume, sorry. So aldosterone is short-lived, and remember that the aldosterone is super important when the renin-angiotensin aldosterone mechanism, which we have gone through and we'll go through many, many, many times. Okay, so we're going to go through a little bit right here. So renin-angiotensin aldosterone system, remember this is a way to make sure our blood pressure stay regulated. So taking a look here, how everything works for blood pressure and aldosterone release. So the main thing is that we're experiencing a decrease in blood volume and blood pressure has gone down. So the kidneys secrete renin. Renin is going to go to the lungs to help stimulate angiotensin 1 to be converted to angiotensin 2. Angiotensin 2 is going to do its job and it's going to stimulate aldosterone from the adrenal cortex. The aldosterone is going to bring in the sodium, which in turn brings in the water and increases the blood volume, which in turn increases the blood pressure. So there's a couple of uncommon things that occur, but it's called hyperaldosteronism, and normally that's an adrenal tumor, and normally you get hypertension for unknown reasons. A lot of times we're going to look at these people who they've been on 3 different blood pressure management medications, nothing's working, and then we put them on something called aldosterone, which is also known as spironolactone, a drug, and also it magically works. So we realize that there's something going on in the adrenal cortex. We have glucocorticoids, which are mainly cortisol. So job of cortisol is to help maintain blood sugar and also a little bit maintain blood pressure. But the main things I want you to remember about is that it helps glucocorticoids, sweets, sugar, helps keep blood glucose levels relatively constant. Fun facts about cortisol, though, is that cortisol, when we're chronically stressed, like maybe being a student, I don't know, or a teacher or a doctor or something, or COVID, who knows? When we're constantly pumping out cortisol, cortisol is supposed to be in response to a little bit of stress to help give us our blood glucose bump so we can get through the day, get through the things. We're constantly shooting out cortisol, we're constantly shooting out blood sugar and constantly under stress. So you can imagine what that would do on the body. So adrenal cortex is regulated by ACTH, and ACTH is regulated from the hypothalamus by cortisol rhythm or releasing hormone. And it said the object of the adrenal cortex, its main object for glucocorticoids is cortisol, particularly is to increase blood levels of glucose, fatty acids, and amino acids. And it causes gluconeogenesis, which means formation of glucose from fats and proteins. When we have too much of this cortisol going, it can lead to weight gain because we're constantly having these extra glucose and fatty acids. Our body doesn't use them because we're probably not needing to use them at that time. We get weight gain. Okay, and then excessive amount of glucocorticoids or excessive amount of cortisol is bad. So when we have too much cortisol, we can depress the cartilage and bone formation. It can inhibit inflammation by decreasing the release. It can depress the immune system. So when we're really stressed out, constantly have cortisol, we tend to get sick more often, and also disrupt our cardiovascular, GI, and neural functions. When we have something, when too much cortisol is being made, it's called Cushing's syndrome. And normally it's from a pituitary and a tumor in the pituitary. And basically they have these really swollen faces called moon faces and a buffalo hump, which is a big piece of fat that just hangs out on the upper part of the back like a buffalo hump. Sometimes it's caused by drugs, sometimes it's caused by a tumor. Other things we might notice, their electrolytes are off or their glucose is off. And then we have Addison's, which is the opposite. So Addison's is the adrenal gland not functioning. So we need to add more adrenal hormones. So usually it's deficits in both glucocorticoids and mineralocorticoids. We get sudden weight loss, severe dehydration, and hypotension. Normally they have to be on some kind of corticosteroid replacement. And what we have here is a specific thing that we find in Addison's disease, which is bronzing of the skin. Fun fact, ACTH, adrenal corticotropic hormone, also stimulates melanin to be produced from melanocytes. So what we'll typically see is in the crease of someone's hands is lots of bronzing right here. We're calling bronze diabetes because of this ACTH activation. We're having more melanin, and that's normally a big key that Addison's is happening. So here's an example of Cushing's. So see this woman beforehand and after. She's getting that moon face is that little buffalo hump right here. So moving on, so remember the deeper go, the better it gets. So now we're adrenal sex hormones. Most of them make weak androgens that are converted to testosterone in the tissue cells and some of the estrogens. So mainly we have DHEA is the one thing that we're considering. So what these DHEA and gonadotropins do is they help the onset of puberty and produce secondary sex characteristics. DHEA and some androgens are responsible for sex drive in women. And in postmenopausal women where they have no estrogen being produced, sometimes this becomes a secondary source for estrogen. So just like with everything, we have too much, too little. Sometimes we have what's called adrenogenital syndrome, which is hypersecretion of the zona reticularis. That means masculization. So in adult males, they don't really see much of an effect, but in females and prepubertal males, we'll sometimes see reproductive organs that are maturing too fast. They might have pubic hair too fast, deepening of voice too fast, and females might have beards, body hair that looks like a male, or the clitoris can actually be as big enough to resemble a small penis. Then so the adrenal medulla is mainly for epinephrine and norepinephrine. It's composed of medullary chromaffin cells. And epinephrine, norepinephrine, they're a fight or flight, so they're causing vasoconstriction, increased heart rate, increased blood glucose levels, and help blood divert to the brain, heart, and skeletal muscle when needed. And both of these hormones are basically the same. So when you say norepinephrine, you can assume it does basically the same thing as epinephrine for your guys' purposes. And as I said, stress on the adrenal gland. When we're constantly stressed out, we're putting too much tax on our adrenal gland. Our adrenal glands do get tired and they don't want to work as well for us. And that causes a whole slew of other things. Basically the tenet of naturopathic medicine. Okay. I'll let you guys look at that in your own happiness. So hyposecretion of epinephrine, norepinephrine doesn't really cause any issues, but hypersecretion most likely is due to a tumor called a pheochromocytoma, which is the medullary cells are overgrown and you get really high blood pressure, rapid heart rate, high blood sugar, intense sweating, heart palpitations, and it's really important to get that, nip that in tushy quickly. One of the last few glands that we're going to talk about from the not from the anterior pituitary, but from the brain is called the pineal gland. And woo-woo stuff, it's known as your third eye. Ooh. But its main job is to do melatonin. Melatonin is really important for sleep-wake cycles. It's the reason why we get tired, and it's the reason why our bodies understand what's called circadian rhythms, which is night versus day. Daytime, nighttime. If anyone knows what it's from, that's awesome. Melatonin is actually a really potent antioxidant, so we can use it sometimes as far as certain treatments that we do as for natural medicine. And it also affects the timing of sexual maturation and puberty, so we always take a look at that as well. So some other endocrine organs that we need to consider and super important are the pancreas. I'm sure you guys hear about it all the time. Diabetes type 2 is very prevalent in our society. The pancreas is both an exocrine because it helps make digestive juices, excuse me, which we'll learn about in a couple of weeks, and also makes hormones. We have alpha cells that are made from pancreatic islets. Pancreatic islets are known as islets of Langerhans, and these are what have the endocrine cells. So we have digestive exocrine, which are coming from acinar cells, and then pancreatic islets, islets of Langerhans, also known as, which make the endocrine cells. So contain the endocrine cells. So we have two different types of endocrine cells that I want you guys responsible for. Alpha cells make glucagon, which can raise your blood sugar, and insulin from the beta cells, which decrease your blood sugar. With diabetes, what normally happens is that either if it's type 1, your body just is attacking itself and can't make the insulin, so you constantly have a high blood sugar, or your insulin gets tired, which is type 2, insulin resistance, and just stops responding to it. So we have high blood sugar. That's what metformin's working on, which is a type of diabetes medication. So if we took a look at it under the scope, this is what it looked like. Everything looks different. So we have this pancreatic islet, we have alpha and beta cells, and then on the outskirts here, we have our acinar cells, which are exocrine. So glucagon, as I said, it's a very potent hyperglycemic agent. It is, as soon as it's triggered because your blood sugar has gone too low, and it could work really fast. So it's triggered by low blood liver levels, which then in turn go to your liver, and the liver can break down some of its stored glycogen by a process called glucogenolysis. And you do have to know the differences between these terms. This will be quizzed. Glucogenolysis is the breakdown of glycogen. So you're going from glycogen to a usable source of glucose. It also can stimulate the glucose from lactic acid and other non-carb sites to make gluconeogenesis. And it also directly releases the glucose in the blood, so we can get a blood sugar increase. Insulin, on the other side, its idea is to inhibit the amount of blood sugar. So it's meant to bring blood sugar down. Okay, so it responds when glucose is too high, and it shuttles blood sugar into our cells to be used. And we don't need to know all these little things, but little fun facts is that it does play a role in neuronal development, learning, and memory. And here are the key things that happen when there's insulin release. So we get elevated blood sugars. That's the primary stimulus. So what ends up happening is that we don't have to know this in full effect, but we get the increase in blood sugars. And basically what's happening is that our bodies are sensing that insulin is secreted, and it helps bring it back down. So the main key players to here to know is that insulin and glucagon work together to keep a homeostasis, not hemostasis, homeostasis of blood sugar levels. Too high and too low are detrimental to our health. We need it just right. What happens when we have too high? We got lots of problems that occur. So in type 1, we discussed there's two different types of diabetes. There's the one that you're born with, or sometimes that you're not born with and happens for other reasons, which is type 1, which means that you're not secreting enough insulin. Type 2 is that you're secreting insulin, but it's just not reacting right. There are 3 signs of diabetes that you want to hear in your clinical patients as well, if you want to take a look at, which is called polyuria, which means they're peeing all the time. Basically, glucose acts like a diuretic, so it makes you pee all the time. Polydipsia, you're losing water all the time, so you're really thirsty, trying to make it up. And you're really hungry because your body is is either insulin is not working or the insulin is not reacting, and your cells are not getting the glucose, so it thinks it's hungry, so it's making you feel more hungry. So that's why type 1 diabetics are typically really scrawny and tiny. Type 2 diabetics, we tend to see central adiposity occurring. And then one of the fun things to know is that when someone is diabetic, and if they can't shuttle in their blood sugar, guess what the body starts doing? It starts breaking down fatty acids. This forms something called ketones. In recent trends, we've heard something called keto diet. It's basically working on the same theory here, that if we deprive our cells of glucose, it's going to start using fatty acids to use as metabolism. Problem is that ketones are acidic, and if we get too much, we get ketoacidosis, which is very dangerous. We also have something called hyperinsulinism, which is where there's too much insulin secreting, so we get way too low blood glucose levels, and that's normally from a tumor or some kind of other issue, but lots of anxiety, disoriented. Too low of blood sugar can cause coma and death. Okay, so we're taking a look at here, concept of insulin deficit and diabetes. We kind of really already figured out what's going there: polyuria, polyphagia, and polydipsia. Long-term effects, it affects the nerves. If there's too much glucose, guess what? Sugar causes inflammation. Inflammation causes damage. So we got neuropathy, or what known as not losing or feeling your fingers and toes. Eyesight starts to go. It's known as retinopathy. And then the last but not few least is the gonads and the placenta. So gonads are testes or ovaries, okay? Ovaries make progesterone and estrogen. And the purpose of estrogen is for, at least in a female standpoint, is to mature the reproductive organs. It causes the secondary sexual characteristics, so breast enlargement, pubic hair. And with progesterone in a cyclic development, with cyclic cycle with the estrogen, it causes breast development and changes the uterine mucosa, which is known as a period. And then the testes produce testosterone. So in males, this causes maturation of the reproductive organ, gives us the male secondary characteristics, which are deepening of the voice, Adam's apple might get a little bit thicker, body hair, odor, different fat deposition. And you need it for normal sperm production. Without testosterone, you can't have normal sperm. And it helps keep all the reproductive organs in a functional state. Men have estrogen at normal levels, and women has testosterone at normal levels. In women, testosterone is really important for sex drive and maintaining a balance. Same thing in males. Estrogen is not as important, but a little more important for maintaining other levels. And then the placenta, which only comes about when there's a baby being made, can secrete estrogens and progesterones and something called human chorionic gonadotropin hormone, which is when biological females pee on a stick to see if they're pregnant, they're measuring this HCG. And then hormones that are secreted by other organs, we're going to go into the male and the females in a whole another week in a whole lot more depth. So that's all we're going to go through there. But as far as adipose tissue goes, adipose tissue has been now classified as an organ. So fat is an organ. How little depends on how much you have. But when adipose cells can release a hormone, they can release leptin, which helps control appetite. Something called resistin, which helps work as an antagonist to insulin, and adiponectin, which enhances the sensitivity of insulin. So then you see why body fat and diabetes play such a huge role with each other and insulin. The GI tract has a whole bunch of its own hormones, which we'll get into in the digestive system. But we have gastrin in the stomach that releases hydrochloric acid, which is your stomach acid. We have ghrelin that comes from the stomach that stimulates you to get growling in your belly so you can get hungry. We have secretin, which is from liver and pancreas, and a whole other slew of hormones that I don't want you to get into. The heart, and I said there was a hormone made by the heart. It's called atrial natriuretic peptide, and it decreases the blood sodium concentration, and therefore it can affect blood pressure and blood volume. We already know about the hormones of the kidneys, which is erythropoietin and renin. Skin, guess what? Vitamin D is a hormone. So it's called vitamin D, but it's not really a vitamin, it's a hormone. Calcitriol, so cholecalciferol is the precursor of vitamin D. So we need the sun to use UV light to get cholecalciferol to get it started. And then calcitriol is the active form of vitamin D that helps absorb calcium from the intestines and helps also vitamin D plays a huge role in immunity inflammation, and used as an anti-cancer agent. So it's got a lot of different things. And this is not part of your textbook, but I like to add it because I'm a naturopathic doctor and this is my bread and butter. Environment pollutants do affect your hormones in a negative way. Pesticides, industrial chemicals, things like arsenic, dioxin, and the soil and water that we grow our plants in can all disrupt hormone function if it's not clean. Sex hormones, thyroid hormone, and your cortisol are most vulnerable to these effects of pollutants, and they can so the interference with these glucocorticoids might help explain why high cancer rates are occurring in certain areas. Example is that I grew up on Long Island, New York, and Long Island, New York has one of the highest breast cancer rates ever. There's a ton of environmental pollutants out there, including electric grids that are all around, EMFs from those, and there's a lot of biotech on there, so lots of waste that possibly is going into industrial chemicals that's going into our soil and our water. So on that note, we're going to stop this screen share and we're going to go into the sensory organs.